It's a man's world. James Brown. It's a man's world. Good patience. When it hurts a man to pee. When it hurts a man to pee. Now I know. You're gonna think, oh, it's just a bladder infection. Oh, it's just a UTI. In a man's world.
911, what's your emergency?
Because when you call your doctor, they just gonna tell you to come to the ER anyway. What the ER gonna do, child? What we gonna do? And then I think about men, and y'all don't even want to go to the doctor. Y'all, everything, body parts be falling off like before you go to the doctor. Like, are you serious? How long you been dealing with this? Yeah. Yeah. Body parts just like, you can't even recognize them no more. Vital signs through the roof. You ain't even got high blood pressure. Your heart just like cardiomyopathy, like end stage, because you waited so long in a man's world to go see the doctor. When it hurts a man to pee. When it hurts a man to pee. Baby. UTIs in a man. Any UTI in a man. We always used to say it, but a lot of times it's so common for it to be like something like an STD, sexually transmitted disease that's causing you to have painful urination. Consider that. We used to always say those patients need to follow back up with a urologist because it's more common for women to have urinary tract infections. But when a boy or a male patient or a man, I'm not really going down in the, I ain't gonna even do the alphabet, but when there is painful for anybody with a penis to pee, it could be that you need to go see a urologist. It actually may be more than an STD. So we think, okay, depending on the age, depending on, how they get that, what their social life is, certainly meaning you're younger versus you in your 70s, 80s, that kind of thing. All right. If you like to party, well, maybe we need to test you for gonorrhea, chlamydia. Maybe that's why you're having kind of a urethritis or inflammation of your urethra that's causing you to have pain when you pee. Okay? And it's always interesting because there are male patients with a penis that come in and they're like, it hurts for me to pee, but I ain't got no STD. You ain't got to treat me for STD. I got a bladder infection, ma'am. It's just a bladder infection. It's only a urinary tract infection. No, not necessarily. No, okay. Especially if you're in a certain age group where, you like to party, hey, you like to party, It could be more likely that you're having some bacteria there that's caused by some of the partying that you're doing, okay? So, ain't no shame in nobody game. Go ahead and get that treatment, because it may be gonorrhea, it may be chlamydia. It could easily be an STD that's causing you to have painful urination. You do not have to have a discharge. You do not have to have a penile discharge in order for it to be an STD. Okay? You don't. It could just be a little twinge, a little burning, and that could be you having an STD. Go ahead, don't be denying, and get the shot of the pills. All right? But the biggest thing also to consider is if it's recurring. So if you do that, if you get the treatment, you do the antibiotics, which most of the time emergency rooms will cover you for possible STDs. Most of the time, even if you say, we just go ahead and try to give you the coverage of it, to try to just be what we call empiric and try to cover many things. A lot of emergency room physicians will try to give you an antibiotic that will cover not just a bladder infection, but also some some STDs. Okay. But if you do all of that and it happens again, then yes, you should consider, if it wasn't how you was partying again, you went and partied again. If none of that is associated with why you're having your symptoms, then you absolutely should consider seeing a urologist. Okay? Because it's not as common for men, boys, anyone with a penis to regularly get urethritis or painful urination. Okay? So that needs to be checked. They need to check your prostate. They need to check your urine. They need to check the anatomy. Usually they'll do a cystourethrogram. Okay? So usually they'll do a whole full, take a camera, just like they take a camera and do a colonoscopy and endoscopy. They'll take a camera, numb it up. I know it sounds traumatic. I know. But it's quick. Okay? And you want to know what you don't know, all right? They take a camera and they go in and they're able to look fully and make sure there's no mass, tumor, lesion, anything that could be blocking the flow of urine. Because sometimes if the urine isn't able to freely flow and it backs up, it can be a nivus of infection. So it can, the bacteria can grow because that urine isn't free flowing, right? There's something blocking it, and because it's blocking it, it's just sitting there collecting like, old water, sitting on the counter. That over time, the bacteria grows, same thing, okay? You want to know that. You absolutely want to know that, all right? So anything started in the emergency room, if it continues, meaning if it does not get better, if it keeps coming back, okay, meaning it gets better, but it come back, okay, and if it's not associated with, we like to party, all of that, then absolutely you need to go ahead and prepare that the emergency room is not going to be the final trip. You will need to follow up with the urologist for that, okay? All right, so that is men, boys, anybody with a penis. If it's hurting you to pee, don't not follow up. Don't wait till your body part's about to come all off and you be like, oh, let me go to the doctor. No, it's too late.
911, what's your emergency?